Managing Asthma is a video to help you learn how to manage your asthma. Asthma is a common lung disease that can disrupt people's lives. In Minnesota, about 1 in 10 people have asthma. It can cause people to miss work or school. It can be scary. It is rare, but people can die from asthma. This video will help you learn how to manage your asthma so you can be free of asthma symptoms, be as active as you want to be, sleep through the night, prevent asthma symptoms from starting, avoid going to the emergency room or hospital because of asthma. When you know what to do and you have the right tools, you can manage your asthma. This will allow you to do more of the things you enjoy.
When my daughter's asthma gets bad, sometimes I panic and I take her to the emergency room or urgent care.
Since I learned how to manage my asthma, I'm doing much better. My asthma action plan helps me know what to do next.
What is asthma? Asthma may be a lifelong lung disease. Asthma can't be cured, but asthma can be managed. Asthma is a disease that affects the airways in your lungs. Next, we'll show you what the inside of an airway looks like with and without asthma. This is a drawing of your airways and lungs. This is a close-up of an airway without asthma. The inside of the airway is wide open and air can flow in and out easily. The drawing on the right is an airway of someone having asthma symptoms. The inside of the airway is smaller, which makes it harder for the air to move through. This is why it feels hard to breathe. 3 things block the inside of the airway, making it smaller and hard to breathe. 1. The muscles around the airways get tighter. 2. There is swelling inside your airways. 3. The airways make mucus, which plugs the airway. When the airways get smaller, asthma symptoms start. Symptoms of asthma can be different for each person. People can have 1 or more of these symptoms. Coughing, wheezing. The chest hurts and feels tight. It feels hard to breathe. Breathing may be faster than normal. With exercise, you may have coughing or wheezing or feeling short of breath. These are the common asthma symptoms, but asthma symptoms can be different for each person. Triggers of asthma symptoms.
I didn't think my smoking was making my asthma that much worse, but I found that when I quit smoking, my asthma really improved.
I know that when my daughter gets a cold, she gets asthma symptoms. I follow her asthma action plan and start her rescue meds. I also take her every year to get a flu shot.
Triggers are things that cause you to have asthma symptoms. If you know what makes your asthma worse, you can try to avoid it. Colds and the flu are the most common triggers. You can help avoid getting sick by washing your hands often and getting a flu shot every year. Other common triggers to avoid include tobacco smoke, pets with fur and feathers, house dust mites, mold and pollen, pests like cockroaches and mice, smoke, candles, and incense, and strong odors such as perfume, paint, cleaning products, and scented soaps. Helpful reminder: learn what your asthma triggers are and try to avoid them. An asthma toolkit will help you manage your asthma.
How do I know what I should do when my daughter has asthma symptoms?
You can help Johanna by staying calm and speaking to her in a soothing voice. This will help her stay calm as well. Then you should get her asthma action plan and her asthma toolkit. The asthma tools that help you to manage your asthma include an asthma action plan that tells you step by step what to do with your asthma, asthma medicines, and a peak flow meter that tells you how your breathing is doing. Next, we will explain to you how this asthma toolkit can help you better manage your asthma.
Asthma Action Plan. An asthma action plan is a guide to help you manage your asthma. Every person with asthma should have an asthma action plan. Ask your doctor for an asthma plan if you don't have one. An asthma action plan has 3 zones: green, yellow, and red, like a stoplight. Each zone will tell you what to do for your asthma. The green zone means go. Your asthma is in good control. When you are in the green zone, you are not having symptoms of asthma and your peak flow number is normal. Most people will have green zone medicines to take every day. The yellow zone means slow down. Your asthma is getting worse. You may be having asthma symptoms of coughing, wheezing, or trouble breathing. You will have yellow zone medicines to take to keep your asthma from going into the red zone. The red zone means stop and get help. You may be having severe symptoms such as trouble walking or talking even while you are sitting down. This is a medical emergency. Follow your red zone instructions.
An asthma action plan will help you manage your asthma. Talk to your doctor if you don't have an asthma action plan and ask for one. Keep it in your wallet or on your refrigerator so you know what to do if you have increased asthma symptoms. Parents, ask for an extra copy of that written asthma action plan to bring to your child's school or daycare.
A peak flow meter is a tool that measures how well air moves out of your lungs. It is used to check asthma the way a blood pressure machine is used to check for high blood pressure. It is one tool to help you manage your asthma. A peak flow meter can help you know when asthma symptoms are starting so you can start taking your rescue medicine right away. There are different types of peak flow meters, but they all work the same way. Here are the steps to use a peak flow meter. First, open it up. Then slide the marker down as far as it will go. Take a deep breath with your mouth open. Put the meter in your mouth and between your teeth and close your lips firmly around the tube. Do not put your tongue in the hole. Blow out 1 time as fast and as hard as you can. The marker will go up and stay up. Note the number where the marker stopped. Repeat these steps 2 more times. Write the highest number of the 3 blows on your daily asthma record. Your doctor may ask you to check your peak flow number every morning and at bedtime. Once you know your peak flow number, look at your asthma action plan. Check to see if you are in the green zone, the yellow zone, or the red zone. Follow the instructions for that zone. A daily asthma record helps you keep track of symptoms. This helps your doctor see how well your medicine is working and if your asthma is under control. Bring your daily asthma record to your follow-up visits with your doctor. Helpful reminders. An asthma toolkit can help you manage your asthma. Ask your doctor for an asthma action plan if you don't already have one. Keep track of your asthma by checking your peak flow number every day. Fill out your daily asthma record. Bring this with you when you go to the doctor. Next, we'll talk about asthma medicines. Asthma medicines come as inhalers, pills, liquids, or nebulizer treatments. There are 2 types of asthma medicines: rescue medicines and control medicines. Most people with asthma need to take both kinds of medicine to manage their asthma. Rescue medicine is sometimes called a quick relief or reliever medicine. Some names for rescue medicines are albuterol, Proventil, ProAir, Ventolin, Xopenex. Rescue medicines work fast. They relax the muscles around the airways to open them up and make it easier to breathe. It is important to know that rescue medicines do not help to decrease the swelling inside the airways. Only control medicines do that. Asthma control medicines are sometimes called preventive or controller medicines. Some names of asthma control medicines are Flovent, Advair, Symbicort, Pulmicort, Qvar. Asthma control medicines help to stop the swelling and mucus inside the airways. They do not provide quick relief of asthma symptoms. A rescue medicine is needed for quick relief. To prevent asthma symptoms, asthma control medicines need to be taken every day, even if you don't have asthma symptoms. Remember to rinse your mouth after using your asthma control inhaler. This helps prevent side effects such as mouth sores. Asthma medicines come in many forms, including pills, liquid, inhalers, and nebulizer solutions. Most asthma medicine is breathed in using an inhaler or nebulizer. It is important to know how to use your inhaler or nebulizer the right way to be sure the medicine gets into your lungs. Helpful reminders. Take your asthma control medicine every day, even when you don't have asthma symptoms. Do not share your asthma medicines or nebulizer supplies with other people. Keep track of how much asthma medicines you have left and get it refilled before you run out. When you know what to do and you have the right tools, you can manage your asthma. That will allow you to do more of the things you enjoy.
We are your partners in managing your asthma. Get an asthma checkup every 6 months, even if your asthma is well controlled. And please, feel free to call if you have questions or concerns about your asthma between those checkups. Thank you.